welcome everybody. I am Lynn, Head of Professional Standards at the British Dyslexia Association. I was very keen to do this webinar this evening, and it's going to be something that we continue to go and do on a regular basis to inform people, parents, individuals, educators, anybody who would like to know a little bit more about full diagnostic assessments. So we've got some things that we're going to go through tonight, which I will just share with you. So we're going to talk about the benefits of having a full diagnostic assessment, the limitations, because there are some limitations, key points that you should consider and need to know, how to choose an assessor, what to look for when you're choosing an assessor, what you might expect from assessment before it happens, while it's happening and afterwards, what a remote assessment might look like, and we'll talk a little bit about our service. But the most important thing is that you will have the chance to ask any questions that you would like to ask. So the benefits of having a full diagnostic assessment. So a full diagnostic assessment is different to a screening. A screening is where somebody might do some in-person tests, or they might go on a computer and do something, and it will give them an indication of whether it's possible they have dyslexia. But the only way to really truly diagnose dyslexia is to have a full diagnostic assessment. And assessments are they're quite long, they're about 2 or 3 hours, and they look into a lot of areas, which I'll talk about later. And they therefore provide a profile of your strengths and challenges, or your young person's strengths and challenges, if they're seeking an assessment. And the most important part, I think, is the recommendation section. So the point where we say, right, these are the difficulties that we see, this is how they might be managed at home, in the workplace, or at university setting, school, etc. And there is a funding stream called Disabled Students Allowance, which individuals can have if they're at university if they've been diagnosed with a specific difficulty. Or it might be they have a medical difficulty or something else, but in terms of dyslexia, they would need to have a full diagnostic assessment report to access that funding at university. Of course, for some individuals, it is just knowing. It's just knowing the answer. It's just knowing whether they have dyslexia or not can be one of the great benefits of having an assessment. Okay, so of course there are limitations. Despite the fact, you've had this assessment, there is no obligation for an educational workplace to put in place all the recommendations within that report. Those recommendations are, as the word suggests, recommendations. But they are required, if you've been diagnosed with dyslexia, to put in place reasonable adjustments. This term, reasonable, because dyslexia is considered a disability and therefore comes under the Equality Act. So if you've been diagnosed with dyslexia, there'll be recommendations. They should be thinking about putting in those that are reasonable, putting in place those that are reasonable. This one is a common misunderstanding. So you do not need a diagnosis of dyslexia to get exam access arrangements for SATs, for GCSEs, for A-levels, okay? Exam access arrangements are based on need. So if you work slowly in the classroom, if you've had a reader all the time, etc., you should be entitled to exam access arrangements if your speed of working is slow or your reading is a difficulty, etc. Reports can provide supporting evidence, but they are not evidence directly for exam access arrangements. That's based on what you need, what your normal way of working is. Some schools will commission a full diagnostic assessment to inform access arrangements, but that's not common practice. And actually, it's not necessary. If you just want exam arrangements, if that's your main focus, then you don't need to have a full diagnostic assessment. Speak to the educational setting you're in, and they will be able to progress that for you. Assessments generally explore dyslexia and not other specific learning difficulties such as ADHD, dyspraxia, and those sorts of things. There are different ways of going about that depending on your age, but we're talking about full diagnostic assessments for dyslexia. Some assessors can explore maths difficulties as well. It's a growing field, that it's not so prevalent. There's not so many assessors that can do it. but there are some assessors who can explore maths difficulties, also known as, well, it's not also known as, it's a separate thing. So maths difficulties, but some people have dyscalculia, which is a particular difficulty with maths. So some key points that you will want to note. We can't assess anybody under the age of 7. Okay, the reason being is that the progress of young people is so diverse before the age of sort of 7 or preferably older, that it's really hard to unpick dyslexia, and the chances of getting an incorrect diagnosis are higher. And it's even more important now to say really they should be 8, because the reason being is COVID, actually, because so many young people lost a lot of education through COVID, that it's really preferable to wait until they are around 8 years old, if not older. So there are 2 sort of subsets of people who can carry out full diagnostic assessments for dyslexia, and they are specialist teachers with an appropriate qualification, and I will talk about those qualifications, which can be a little bit complicated, in a short while, and also educational psychologists. So specialist teachers are individuals who've worked in an educational setting and gained a level 7 qualification that allows them to be able to diagnose dyslexia. Educational psychologists are part of the sort of psychological society, and they are members of the Health and Care Professions Council, and that's where they gain their qualification. And they tend to be able to look more broadly at the individual and their differing needs that might be more than one specific difficulty, whereas specialist teachers tend to focus more on just dyslexia or dyscalculia, and they've worked in an educational setting and they're more au fait with what the support that individuals might have in those settings. The cost of having an assessment can vary greatly. As a guide, a specialist teacher might charge you around £500 to £600, and an educational psychologist might charge you around 700 plus, more likely around 800, because they have that broader range of things that they can look at. And that is a high cost, and that's appreciated. And it's not something you can get on the NHS. It's not classed as a medical difficulty, therefore you can't get funding in that respect. However, you can, the BDA try and do bursaries. We fundraise regularly to provide bursaries for people so that we can pay for assessments. You could talk to your local dyslexia association. You could talk to your employer if you're employed. You could talk to the school if you're in a school setting. Or, if you're a member of a sort of religious society, then you might want to check with them. There are various ways of trying to get funding, and if that's something you particularly want to ask about, the best thing to do is to contact our helpline, and they are very skilled at guiding people as to where they can look for funding for assessments. Just to note that to be able to use a report now or later, because reports last a lifetime now, that individual needs to have an assessment practice and certificate if they're a specialist teacher. No, need to put my teeth back in. So if a specialist teacher does the assessment and you want to be able to use it for university funding now or later, then they must have an assessment practice and certificate. I'll talk about that on the next slide. Alternatively, they would be an educational psychologist registered with the HCPC, the Health and Care Professions Council. Okay, so one of these is more straightforward than the other, I think, is the answer to this. So what do you need to check when you're choosing an assessor? This is actually quite an important one, okay? So if you choose an educational psychologist, they need to be registered with the Health and Care Professions Council, and we would expect them to have a DBS check, which is the check of you have when you're working with young people or people who are vulnerable, etc. And they should be adequately insured, so have professional indemnity insurance. Just. Specialist teachers are a tiny bit more complicated. So A specialist teacher can diagnose dyslexia if they have a level 7 qualification they've completed in specific learning difficulties. And the way to check that is to ask for their certificate. Okay, just ask. Okay, if you contact someone, their assessor, ask for the level 7 certificate. Now, we would strongly suggest that you choose an assessor who has an assessment practicing certificate. As I mentioned on the previous slide, if you later down the line decide that you or the young person assessed wants to go to university, only a report carried out by someone with an APC can be used to provide evidence for that funding. And the other benefit of assessment practicing certificate being the choice is that these individuals, they have to submit a report to be checked every 3 years. They have to keep up to date with their professional development. They have to undertake training on an annual basis, and they submit that every 3 years, and their reports are checked. The first 3 reports are checked, so the first 9 years are checked effectively, and then they still provide CPD to keep it up to date. So it's a check, as it were. And that doesn't come from us at the BDA, that comes from an organisation called SASC. SASC is SASC, and it stands for the SPLD Assessment Standards Committee. And they manage the APC process, and it's managed via 3 organisations. One is the BDA, one is a group called PATOS, which is PATOSS. I won't tell you what it stands for, it's too long. And the other one is Dyslexia Action. So those 3 organisations can check people's reports and allocate them an assessment practicing certificate if the report passes. That's complicated, I appreciate. I'm happy to answer questions about that again if it's something that didn't get absorbed. We at the BDA would also suggest that you choose someone who has AMDA, which is Associate Member of the British Dyslexia Association. It's not compulsory when assessing, but people who've got an AMDA qualification have done an AMDA course, and that guarantees that they have undertaken at least 20 hours of supervised specialist teaching. So they've worked with young people, someone's overseen the work they do with that young person, they've watched videos of them teaching that young person, and in theory that makes them very good at supporting young people, knowing the best ways to support people in educational settings. It doesn't have to be a young person actually, so my qualification is in further and higher education because that's where I got my experience mostly. Specialist teachers, the same as educational psychologists, need to have a disclosure borrowing service DBS check, and they should have insurance so that if you're in their home or something, you know, there's any queries about assessment, then there's adequate insurance in place. If you want to check that someone has a assessment practicing certificate, you can go onto the SASC website, the SASC website, and you can search for an assessor and it'll tell you if they have a practicing certificate. If you want to know if someone has AMDA and that their AMDA is up to date, then you would ask for that AMDA certificate, and that would be dated within the last 3 years because they last 3 years. I think I've said everything there. I hope I haven't missed anything. Okay, so what's going to happen in the assessment process? You'll contact an assessor, whether you find them on the SASC website or via us or via another organisation or privately, and you will confirm with them. You'll get the dates booked in once you've agreed that you're good to go. And they should be sending you out some questionnaires to complete beforehand. It's really important that we gather information about individuals before assessment. There may be something we need to take in consideration in the assessment. So if they've got a short attention span, when we plan our assessment, we would be putting in lots of breaks. Or if they use a coloured overlay, we would want them to bring it. Or if they have maths difficulties, we would want to assess their maths. And then if it is an online assessment, you would be sent something like a Zoom link. It might be Teams or it might be Skype, but an online platform link, probably nearer to the date of your assessment, not when you book it, because sometimes they're booked quite far in advance. And if you're going in person, you would be provided with some address details. So during an assessment, this is what you would expect. It's quite long, an assessment. It can take sort of around 3 hours. And there's a good reason for that, is so we can explore fully the individual's strengths and limitations, if we want to call it that. And it can be very tiring for people. So you probably don't want to do it after work, you probably don't want to do it after school or something like that. You probably want to do it when you're at your peak, as it were. And they should take place in a private space or online, and online, you know, with no interruptions, in a space where you can focus on the assessment itself. And you will undertake a series of tests. Now, they're not pass or fail things. They're designed to find out what your ability in the areas assessed are like. And they will definitely cover reading, writing and spelling, because those are the areas that individuals with dyslexia may struggle with. But they will also check your underlying skills, your ability to use sounds, that's what phonological awareness is, your speed of processing, which is the speed with which you can pull information forward, and your memory, what your memory is like. And the reason those areas are focused on is because the definition of dyslexia that we currently work to, that's what it says it is. That's what it says dyslexia is. So we identify it by looking at those things. The assessor should talk to you beforehand, gather a bit more information, make sure you're comfortable. And after the assessment, the assessor may be able to give you information about what they found, but they may also need further time to look at the scores, to work them out, to decide what it all shows. So there's no guarantee at the end of the assessment session that you will be told whether you have dyslexia or not. Some will be able to, some won't. But what you will do is have a written report afterwards. And the written report will confirm whether you have dyslexia or not. And it will have a profile of you. It will talk about the assessments that you did. It will say what these assessments showed. And as I said before, I think the most important part of that is the recommendations, whether it's for your school, for your university, for your workplace, or for home. There'll be recommendations in there. In terms of the workplace, recommendations may not be specific to every job. So assessors don't know every workplace, but they would recommend that you had a workplace assessment, and that is where somebody would then come in afterwards and have a chat with you about your job in particular. The report belongs to the individual who was assessed, or if it's a young person, their parent or carer that commissioned the report, as it were. So the assessor isn't, you know, entitled to share it with anyone else. That would be a data protection breach, unless you've agreed otherwise and you sort of signed something beforehand to say that's fine. So if you are in a school setting, you know, you should share it with the school yourself. Workplace, share it with your workplace, unless your workplace has commissioned it and therefore there's an agreed share. Remote assessment is increasingly common, and the majority of sort of older, you know, assessments for older people are carried out online. Our personal stance at the BDA is that an individual should be 12 or over to undertake a remote assessment, just because of their ability to manage the demands of it. But some assessors will assess younger ages, and there's no sort of stipulation to say they can't. And an assessment online will be just as robust as one in person. They'll be able to share things on the screen, you'll be able to access them, you'll be tested in a very similar way, it will just be online. And having an online assessment has a number of advantages, because you might feel more comfortable at home, you know, you've got your familiar surroundings, you'll be able to go get a drink for whatever you want, as opposed to the assessor just offering water, etc. And there are lots of reasons. And, you know, you might not have to travel, and you could get an assessor from anywhere in the country if you did a remote assessment. But again, probably most suited to people who are 12 or over, possibly. You do need, obviously, if you're having a remote assessment, to have a good screen size. You can't do it on a phone. It has to be a good size tablet or a laptop, or you know, a full size computer screen. And you need a reliable internet link. You know, you need to be able to hear clearly, you need to be able to see clearly to be able to do this online. Again, the assessor, oh, it's about typo there, sorry, I'll check that later. We'll send you a link to an online platform to carry out the remote assessment. Okay, so as I sort of said earlier, there are things to look for when choosing an assessor, and you can go out and seek an assessor independently. There are lots of very able, very competent, qualified assessors out there who do very, very well, but just make sure that you are checking that they have an APC, preferably AMDA, you know, the insurance and the DBS, to make sure that you are safe and covered. If you come to the BDA, we charge £550 for a specialist teacher plus that, and I'll just check my numbers, 700 plus that for an educational psychologist assessment. They're slightly more expensive, but the benefits are that we check our assessors, their reports are reviewed on a regular basis, so we look at them on a regular basis, we give them lots of feedback to support them. Some assessors attend regular meetings so that they can ask questions and keep up to date with practice, which they'd be doing anyway as part of their CPD. But there are sort of ways that we monitor our assessors and make sure that they have the information they need. And if you have a query, a question, you know, you can come back to us as the BGA if you have a query about your assessment. So currently we've got a referral service and a corporate service. So, but I'm going to talk about what's going to be happening from the 19th of February because it's only a week or so away. So from the 19th of February, we are going to have a remote service whereby we will provide an assessor to do a remote assessment for those over the age of 12. And the alternative, if the person is 12 or younger, or if they can't manage a remote assessment, is that we can refer you to an independent assessor who works closely with us. And again, we check the reports, they can contact us, they can ask questions. So we've kind of got a two-tier service for people who are paying for the assessment themselves. Okay, so if you are 12 plus, can have a remote assessment, you can go for our remote service and we allocate you an assessor that works with us. Or if they are under 12 or can't cope with the remote assessment, we can refer you to an independent assessor who would do a face-to-face assessment. The third option is if the assessment is funded by your workplace or the child's school, or sometimes it's social services, or you know, anybody who is paying for it that isn't yourself is under our corporate service. And again, we arrange it all, we allocate an assessor who works with us, and that person again has their reports checked on a regular basis, has regular contact with us, etc., etc. That is the service that we offer. But again, there are independent assessors out there. Look on the SASC website, you'll find them on the internet, but just you know, the advisory is to check that they have those qualifications we discussed earlier. Okay, so just to this is the contact email address if you have questions about assessments. However, we've got all this information on our website. Nothing I've said tonight isn't on there apart from the stuff that's starting on the 19th of Feb, and that will be on there from the 19th of Feb. So look on the website, there's frequently asked questions. It talks to you about the qualifications of assessors that you need to check. All those sorts of things are on the website under our assessment services. But here is the email address if you would like to contact anybody. And we've also got the helpline that I mentioned, who can talk to you about assessments if you want to ask any questions again, but mostly about things like funding for assessments, where you might go, etc. Okay, I think I've talked enough. And the most important part of this evening is to allow you the opportunity to ask any questions. So bear with me while I just try and get rid of this on the screen.
Thanks, Lynn. That was great. I almost feel like it was a information overload, because when you're trying to learn it all, but as we said at the beginning, we will send the recording out. So if there's anything you didn't quite catch, there's a lot of acronyms and things going on the team to try and break down the information. But yeah, we will send them a video so you can see it again. But we are getting a few questions coming in. So let me just go into these. So we've got somebody asking, how do these assessments differ from or contribute to an NHS education health plan, care plan?
An education health and care plan is an educational setting based document that is for people with severe difficulties that require help over and above that normally allocated in the classroom, which I'm sure that the person who's asked the question knows. If you would like a contribution regarding dyslexia for an EHCP, that would need to be somebody that's allocated by the school. So an educational psychologist would be not employed, they use the local services, would be brought in from the local services, and if to diagnose dyslexia or to look at dyslexia and add it to an EHCP, that would be something the school would arrange.
Okay, thank you.
That makes sense.
Yeah, it does. It does to me, but hopefully it does.
Hopefully it answered the question.
So I have another question. What age would you recommend an assessment is done? As soon as possible after they're 8, or would you suggest they wait till they're secondary school, or is there an ideal age, or is it even actually when they go to university?
That's a really good question. I think the earlier the better is probably the right answer. So 8, as I was saying, it was probably the ideal age. The earlier you catch it, you can think about the recommendations. The assessor should be thinking about recommendations, not just for then, but also for when they go to secondary school, and a little bit about when they go to university, they would indicate. So yes, I would suggest 8 is ideal. But if you haven't had an assessment, or your young person hasn't had an assessment and they're older than 8, it's still okay later in life. Don't get me wrong, it's fine.
Yeah.
I assess somebody who's 60.
I was going to say, we get lots of people, don't we? I know when I first started the BDA, somebody said they'd just done an assessment on somebody that just turned 60, and they said it was like a light bulb moment. They'd always realised they'd had these challenges, but just never realised what they were. And even 70s, 80s plus, it just helps understand how your own brain works. Sometimes it's just, it might not be for work, it might not be for school, but sometimes it does help.
I have been in assessments with lots of tears, actually, from people who've, it's suddenly clicked for them, and they cry, you cry, and you're happy,
Yeah, it's an understanding, isn't it? It's just finally understanding why you do things, because some things in life you don't always know, do you? You don't know why you do things a certain way, but an assessment can help with that. So I get it. I get why that they talk about the light bulb moment. Okay, we have another one. What do you know what the waiting time is for workplace assessments?
Workplace assessments. Don't think the waiting time for workplace assessments is too bad, as far as I'm aware. I'm not sure, actually. Can you email assessments email about that?
Yeah.
If you said diagnostic assessment, I could have told you, but
okay, thank you, no worries. The messages are all coming in now, so it's scrolling too fast. So I think I know what the answer will be to this, but under what circumstances was a school fund an assessment?
Very few circumstances. Yeah, you knew I was going to say that. It really is down to the individual school and the individual school's funding. And I don't really want to say more than that, I don't think. But it's rare for a school to fund diagnostic assessment.
Yeah. And how reliable would you say that the screenings are that are completed by schools?
Some screening tools are very, very good. It really depends on the tool, and I probably shouldn't promote any one in particular, but I will say one. So there's something called Lucid Exact, which is an online one, and as long as the young person is fully engaged when they undertake it, it gives a pretty good representation of their ability in areas related to dyslexia. But there is this kind of risk if you do a computer assessment that maybe it's to do with the mouse not working or not being able to type efficiently and things like that. But yeah, it really depends on the screener, which isn't very helpful, is it really? I do apologise.
No, and having been through the journey with schools, it does depend on the school and the person doing the screener, and like you say, what tools they're using. So it's normally a good indication, isn't it? But that's all it is, a good indication. So that's great, thank you. So you kind of a question here that you kind of covered, but maybe we could go into a little bit more detail. My daughter's school said that if she gets diagnosed with dyslexia, it doesn't automatically make her help with the access arrangements because they have to follow JCQ rules. So I know we did cover up this slightly, but so if somebody has a dyslexia diagnosis or not, but they know they need specific help in, they need access arrangement, what's the process? Who should they speak to, and what then happens at school?
Yeah. So the person you need to speak to within school setting is the SENCO. That's a Special Educational Needs Coordinator. And they will have one in primary and they will have one in secondary and sort of college if they're post 16. And that person is the one who can determine whether access arrangements are put in place. And it's based on whether they are displaying that they need it. So in the classroom, if you want extra time, are you working more slowly than your peers? Are you allowed more time to complete things? That would be an example. And then if they determine that that is the case, then they can get in their own assessor. They don't do a full diagnostic assessment. They just would look at speed of working. If it was extra time, they would look at reading, if the person needed a reader, etc. So if you are looking for exam access arrangements, contact the SENCO in the setting and speak to them about moving forward with that.
Thank you. What support would you recommend for a child under 8 who's suspected to be dyslexic?
Yeah, I mean, there's you know, it depends what they're struggling with. Is part of the answer to that question. There are ways of supporting people with dyslexia or suspected dyslexia, and that often relies on non-traditional methods. So if I give an example, if you've got a young person who is struggling to learn spellings, they've got their 10 spellings a week or 5 spellings, whatever it is, you could get them to write those spellings in a tray of sand or salt or flour or even shaving foam. It gives a tactile feedback, and they should be saying the names of the letters as they do it, etc. So anything that you can use that isn't just reading, just writing, is more interactive than that, is the best way to support a young person before you think about the dyslexia assessment. There are specialist teachers out there. We've got a tutor list of specialist teachers who are have been trained to work with people with literacy difficulties to effectively teach them. We are not the only person with a tutor list. PATOS also have a tutor list, PATOSS.
Thank you. We've got somebody asking about why is it recommended to wait till they've got to the age of 7 before they do a test? Is that purely just because of their development and as a child?
Yeah, development varies greatly. There are early indicators of dyslexia, you know, difficulty with rhyme, things like that, family history, but you've got to give young people the chance because they do develop at such varied rates later, but particularly before they're the age of 7, and it's really so hard to pinpoint it until that point.
Thank you. So we're getting a lot of questions that are asking specifically about dyslexia itself. We do have a whole heap of information on the website. There are also a lot of videos on YouTube that go into different bits and pieces, but I'm trying to find a few questions that will just actually help about assessments for tonight. So somebody's actually asking about is there a separate test for maths difficulties? And I know you were talking about some assessors that can do dyscalculia and things. Could you maybe just touch on what different tests there are?
Yeah, so there are certain things that overlap between dyslexia and dyscalculia, okay, and in general they are sort of difficulties with memory and difficulties with pulling things forward. So the assess that you would use in dyslexia, for those you would also use for dyscalculia, same thing. The difference with dyscalculia is you would look much more in depth at maths. You would explore maths in great detail. You would look at their ability to, you know, sort of their number sense, their ability to know number. Can they look at 5 objects and know it's 5 objects? Can they count forwards? Can they count backwards? Lots of different aspects of maths. And because these things do overlap, you could have an assessment for dyslexia and dyscalculia. And many assessors who do dyscalculia assessments will do dyslexia as well. You're going to be looking at a higher fee for that. So one way to kind of manage that higher cost is to have an assessment for dyslexia first and to ask the assessor whether there are any signs of dyscalculia in that, because there are some overlapping features. And in that way, you might save yourself some money, and you can, if you decide you want dyscalculia as well, you could do a top-up assessment if that person's qualified to assess dyscalculia as well.
Brilliant. Thank you. We've got a few people asking about, is there any point having an assessment if they've already spoken to the school and the school has said it won't change any, that they might be getting support? We don't know that, but they might already be getting some support or might not be getting very much, but the school is saying whether you give us a diagnosis, formal diagnosis, or it's not going to make any difference. What should the parent do then if they're still trying to weigh out whether an assessment is the right way to go?
Yeah. So schools will be putting things in place for people who struggle. They're very good at that. You know, it's sometimes difficult to understand when they're trying to manage the demands of many different pupils, but they will put in place support for individuals. So in that respect, a diagnostic assessment won't change that. The support's in place if the person needs it, in theory. So in that case, you're more looking at, do you want to know for yourself whether that young person has dyslexia? Do you want an answer? Or the other option you might be thinking about is, will I need it later on because they're likely to go to university and therefore I need that diagnostic decision?
Okay, brilliant, thank you. And we've actually got a couple of people asking if they've done screenings. I'm not sure if, I'm presuming they're at school. If they've done screening schools, but they've come back saying that the child isn't dyslexic or not likely to be dyslexic, what would you advise at that point if they still feel like they're showing signs of being dyslexic, or we know it's hereditary, so there might be somebody else that's dyslexic in the family, so they might already know what signs to look for. So what should they do if the screening has said no, they're not? Is it a good advice to still go ahead, or?
I do find that people's instincts are generally right. You know, if you've done a screener, it doesn't show it. As we said before, screeners can't diagnose, and there are lots of reasons why they may not be accurate. And the only way to find out if someone has dyslexia is to do a full diagnostic assessment. Another thing you could do is you could do a checklist. So on our website, we've got checklists you could do as well as the screener, which is more objective. So ask questions like, do you struggle with this? And you tick yes often or whatever. And that could be another way for you to sort of do another sort of check to see whether you should move forward with a full diagnostic if you're still feeling that it should be done. Yeah.
Good advice, thank you. Got a question. Would you recommend a visual stress assessment following on from a dyslexia assessment to see if overlays would help? I know this is a whole can of worms.
The research into the use of not coloured overlays as such, but that this is sort of colour aspect of things has largely been debunked. That's not to say if you use a coloured assessment and it does good, it helps you see things on a page better, you should definitely use it. If you're using coloured overlay, it helps, use it. But visual stress is actually a term used by optometrists. It's not something related to dyslexia. It is a visual difficulty that an optometrist would diagnose. And there's been this common misconception that visual stress is a sign of dyslexia. It's not. Some people with dyslexia have visual stress. Some people without dyslexia have visual stress. So the coloured overlay question is really separate. It is, you know, there's no doubt that for some people coloured overlays make it better and they should be using them. But a visual stress test is not going to tell you, just try one. Just try one. Some assessors will recommend that you go to a behavioural optometrist to investigate it if you're showing lots of signs of visual difficulties, and that is because it is a visual difficulty problem, not a dyslexia problem.
Brilliant, thank you. I've got a workplace question. So if somebody's had a workplace assessment done to support a colleague, what would the result be transported to support the member of staff in their working tasks? So I suppose we're asking what could then be put in place should somebody have a workplace assessment and they need that support?
Yeah, so the workplace assessment should outline the support that should be put in place for that individual.
So it should have a recommendation.
Yeah, we'll have recommendations in it. Yeah, it might have recommendations like using text-to-speech software, using Grammarly, which is checks the grammar of things. So it will tell you what sorts of things you should be putting in place. Yeah.
Brilliant, thank you. This is more of a question about dyslexia than an assessment, but it's very valid. If a child has excellent memory and above his reading age skills, but has trouble writing and spelling, could he still be dyslexic? And if so, what help could they get?
Yeah, they could still be dyslexic. In fact, some people dyslexic just struggle with speed, you know, and that's where they see it in their literacy. How can you help with spelling and writing? Does there any indication how old the individual is?
Oh, I've moved on now. No, I'm not sure if it said. No, just said above their reading age. I'm not sure.
Okay, so at younger ages, things to help with writing would be lots around the oh gosh, there's so much about helping them plan their writing, about managing the demands of lots of different things involved within writing, such as the capital letters, full stops, forming letters, all that sort of thing. With older individuals, I would certainly recommend that they use speech to text when they speak, and that can manage. But you've got spell check when you're older and things like that. And you can ask Siri and you can ask Google and all those sorts of things.
Brilliant, thank you. We've got a few people asking about waiting times. Am I guessing that it depends on the area and the assessors within their area?
Most assessors are booking at least 2 months in advance. Some areas are booking January 2025 at the moment. Yeah, it can be a long wait. So if you're thinking about it, you know, get yourself booked in. I would say.
And have the lists come down now that there's remote options, or is it still quite a long way?
It certainly helps. It certainly helps because then you're not tied to one area, or you don't have to travel a long way to get an assessment. It's more about a lack of assessors. It's just not people. I don't want to defend anybody, but it is a very hard thing to do. You know, we talked about how you've got to keep on top of your CBD, how you've got to be checked so regularly.
Yeah.
It's not for the faint-hearted.
Yeah, I can imagine. Maybe if we just remind people where they can find lists of assessments, and there's a few different options, isn't there, for them to look for those?
Yeah, so if you are seeking an assessment, you could go to our web. That's just one option. You could go to our website. We do have assessors that we can refer to, or assessors that work directly with us. Other places you can go are the SASC website, which is SASC. They will have a list of people who have that practicing certificate that we recommend they should have. You can go online and find people with their own website, independent assessors. So you might search dyslexia Fleet or wherever you are, sorry. And you might be able to find someone, but the way to check those people, as we said before, make sure they've got a practicing certificate, and we would recommend that they had our under qualification as well.
Brilliant, thank you. We've got a question about is an assessment recommended for a 7-year-old, or let's say 8-year-old, because you've said from 8-year-old, autistic child who is 2 years behind academically, or would it be too challenging for them? Should they potentially wait a little bit longer, or do you think it's still worth from sort of 8 and above?
Well, there's two sides to that. You can diagnose dyslexia in someone with autism. You can pick the signs apart. That's absolutely fine. You know, an experienced assessor would be able to do it, or an educational psychologist. The other flip side of that is, how does that young person's autism manifest? Is it going to cause them undue upset to be in an unfamiliar surrounding, doing unfamiliar things? I think you have to balance that one if you've got somebody who gets distressed in that respect.
Okay, and would that be a similar answer to, so if somebody's got other challenges, so you've got somebody that's written in to say that they've got multiple sclerosis, would that also be the same sort of advice? Yeah. So for multiple sclerosis, you really need to let the assessor know what's going to be comfortable for you. You know, you lead that person, you let them know, I'm going to need more breaks, etc., or I'm going to need this, or I'm going to need that. But you can definitely be assessed. That's not a problem at all. The most important thing is making sure that you are happy and comfortable in the assessment. Yeah, no, great advice. So I'm just trying to find some different ones.
So many.
Okay, so this is actually quite a valid question. I know we don't have very long, but just to sum it up, what sort of things do you get asked to do within an assessment?
Yeah, okay, so let me go through from the beginning. So you might be asked to read a list of single words. You might be asked to read text and answer questions on it, either aloud or silently. You might be asked to spell words. Well, you're going to be asked all of these, in fact. And then the funny ones that you might do, if you want to call it that, are to do with the knowledge of sounds, the memory, and the processing. So if you are being assessed on your knowledge of sounds, you might be asked to name sounds and words. So you know, what's the first sound in the word cat, or you might be asked to delete a sound from a word. What is cowboy without boy, something like that. So things to test your manipulation of words. Memory, you'd be asked to remember a list of things like numbers or letters. You might even be asked to recall them backwards. So if I said 1, 2, you would have to say 2, 1. And then speed is measured by asking you to do things quickly. So you might be asked to read something quickly, or letters quickly, or numbers quickly. And tests also look into your vocabulary, your verbal ability, and sometimes your sort of reasoning ability, your ability to look at a problem and solve it. That's a lot, sorry.
In a nutshell, yeah.
In a nutshell.
That's 2 or 3 hours worth.
Literacy.
In 30 seconds.
Signs of dyslexia, and yeah.
Whistle top store. What, can't even say that. Whistle stop tour. I'm just seeing if there's any other ones that there's a lot of questions coming in that are specifics about their child or their difficulty or whatever. I would definitely encourage those people to reach out to our helpline, because you don't, if you can phone in, we have they're open most days, all the times they're on the website, but if you actually want to have a you know, jot things down, you can email as well. You can drop in your concerns, or they can send you advice or point you to relevant bits of information or resources on the website that can help. I think it's probably best to do that than to go into the individual questions that are coming up. But there is a lot of support on the website, and do, like I said, do sign up to the newsletter, because there's lots of information coming through that every month as well. So it might be something that you've not thought of that actually wants you to find out more, a little bit more. On that, we do have other webinars coming up. Constantly doing webinars. We love doing webinars, don't we, Lynn? And the next one in our education series is actually to support secondary age children. So that is on the 20th of February. But like I said, there are a lot of webinars already on our YouTube channel, so do take a look. But there's a whole list of webinars that are coming up on our events page of the website. You might also be interested to know that we are running a conference at the end of the month on the 29th of February, which is creating a positive learning environment. So if you're a teacher or a parent that has a younger child, or a child, not a younger child, any age child, that might want some extra support, it's a fundamentals conference. So it's not going to go into too much detail, but it will give you a great understanding and some great tips and advice on that as well. Again, you can find that details of that on the website. And I'm just quickly checking to see if there's any other quick questions that came in before we wrap it up and we let everybody go for the evening. Oh, so somebody's just asking about the primary school age webinar. Yep, we have an education series of webinars. So we do early years, primary, secondary, and we actually do a workplace one as well. We run those every term. So if you missed it, I mean, if you signed up to it and couldn't make it, then you would have got the recording anyway. But if you missed it or want to tell other teachers or other parents about it, we do run them every term. So just keep an eye on the website, because they're constantly being added and rerun. So yeah, somebody was just literally asking about those. And they're really helpful. There's some great resources on there. There's some great tips. And especially if you're just starting your journey with your child or yourself, you might not know at early year stage, you might not know at primary stage, or you might have decided that they need to go for an assessment or whatever, but actually you haven't then progressed much further. Sometimes when they get to secondary school, they have different challenges, or they have different things that they might need support on. So it's always good to watch the webinars, look at the resources, and as I say, the helpline is there. So do reach out to the helpline if you've got specific questions about yourself or your child or the children that you're educating. They're there to help. But I think we will wrap it up there and just say thank you so much, Lynn and Claudia, for sending all the bits out before, and she'll be sending all the stuff out afterwards as well. So we will let everybody go and enjoy the rest of their evening. Thank you so much for joining us.
Thank you for the love.
Yeah, thank you for the love. Cheers.
Everybody.
Thank you, everybody. Bye.